We're going to discuss this now with Dr. Emanuele Capobianco. He's the Director of Programming at the World Health Organization Foundation, joining us from Geneva. Doctor, thanks so much for your time. The WHO has really been urging people not to panic about this new Omicron variant. It was only identified really about a week ago. What are the most important things that we've learned since then?
We have learned quite a lot, but there is a lot of uncertainty. So one thing that we have learned that it seems that the variant may be highly transmissible from what we are seeing in South Africa, but we don't know yet how well the variant will be able to escape vaccines, and there's an indication vaccines will still be working for against this variant. We don't know yet what severity this variant may cause in terms of the disease. So there's a lot of unknown at the moment. If we look at the globe totally, we know that 99% of the virus circulating is Delta, is not Omicron. But we know also that a number of cases of Omicron have already been identified in different parts of the world.
Well, something that South African scientists have pointed out, I think it was today, they found that people who have had COVID and are then exposed to it again are 3 times more likely to get reinfected if they were exposed to the Omicron variant rather than Beta or Delta. What does this all mean?
Well, what we are probably seeing is the fact that immunity that has been built after an infection with either Beta or Delta may not be sufficient to prevent an infection from Omicron. What we need to understand is whether a reinfection from Omicron may be more severe or less severe than previous infections. So the element of severity is a critical point that we need to investigate in the next few weeks. So we need patience to understand how Omicron will actually affect the epidemic in South Africa and in the rest of the world. And severity is a critical point that we need to investigate further.
And Doctor, what do you make of the travel bans? Will they work, or are they just, as many Southern African countries have called them, just another form of discrimination?
Well, South Africa should be highly commended for the incredible work that they have done, the incredible service that the country has done to the entire world by sequencing the genome and by communicating around. And certainly, the way travel ban have been imposed as sounds discriminatory. What we know that travel bans help to delay the spread of an infection, but as already demonstrated, Omicron is already in a number of countries. So there are better ways to manage the infection and to prevent spreading of the infection. And it's really going back to the type of actions that we have all learned to do, distancing, wearing masks, avoiding crowded places, bringing in ventilations, and then you have quarantine systems that can be put in place, but halting travels altogether is not the solution to a crisis. May also actually damage dramatically the economies in countries like South Africa, and we don't want that.
And of course, all those things you've just mentioned, quarantining, hand washing, wearing a mask, etc. Vaccinations do seem to be the only way out of this pandemic.
Well, vaccinations are critical, and we probably would not have a variant Omicron if we had been able to vaccinate the people in low-income countries. There's a huge issue of inequity that needs to be reverted. And to do that, we need to invest in mechanisms that can bring vaccines to countries. We at the WHO Foundation have a campaign that is called GoGiveOne.org that provides vaccines by citizens to countries. So you can actually donate $4 or €4, and you can get a vaccine into countries. Systems like this one can really reduce inequities and should be supported by citizens alike and by governments.
Dr. Capobianco, always good to get your thoughts. Thank you so much for your time.